What is a mummy makeover from a doctor's perspective? So many burning questions. So little time. I'm Carol Ofori, and this is the Carol Ofori Podcast, where we answer all the questions that keep going around in circles in your head. This time we're asking a plastic and reconstructive surgeon, how risky are mummy makeovers? In a previous episode of the Carol Ofori Podcast, I spoke to reality TV star JoJo Robinson about the numerous mommy makeover procedures she's had. JoJo held nothing back and told us everything about pretty much every single procedure. I asked her if it was all worth it, and if you'd like to know what she said, listen to episode 2 of the Carol Ofori Podcast. Today, I have the man behind the work, JoJo Robinson's surgeon, Dr. Paul McGarr, who is a plastic and reconstructive surgeon with over 20 years experience from right here in Durban, South Africa. Hi, doctor. How are you?
I'm very well, thank you, Carol.
Well, thank you so much for taking time to unpack this very popular conversation. I cannot actually be in a room with moms and the conversation of mommy makeover not coming up. So thank you so much for making time to speak to us.
Pleasure.
I think the big question is, what is a mommy makeover from a doctor's perspective?
So a mommy makeover really is almost a consequence of pregnancy,
right?
Where women have had children, their children are starting to come off their hands a little bit, and they're starting to focus on themselves again. And we have to accept that pregnancy can be quite deforming and have quite a significant impact on the body. There's an impact on the breasts. After breastfeeding, they often deflate and droop and lose size. And with the stomach, with the uterus expanding, with pregnancy, muscles get stretched, skin gets stretched, there's weight gain. Patients often can't lose all that weight. Sometimes patients will come in and say, people are still asking me if I'm pregnant or congratulating me.
Wow.
And I'm not because people do that. They got no filter.
Yeah.
And so they become very self-conscious. They lose confidence. And those are the patients that come through wanting those two areas to be addressed.
Now, would you say over the past few years, this has been the most popular procedure that most of your patients are coming for?
So certainly those two areas are the most common. Not everybody has, been a mom who comes through for that.
Okay.
But certainly it's often the preceding event has been pregnancy and having children.
Yeah. Just out of interest, how long have you been in the plastic surgery space?
So I finished training in 2003, so 20 years,
Yeah, 20 years. And in the 20 years of your experience, has this been the tummy tuck and the breast lifts, for example, been something that have been around for the past 20 years? Have you found more of interest in this mommy makeover over the past couple of years?
Absolutely. The procedures have been around for many, many, many years.
Yeah.
But the interest and the drive for it has grown. And as patients hear of friends who have had the procedure and things have gone well, that sort of generates the interest and the desire for the operation.
Now, who would you say is a good candidate for this? Because I believe that for this is a medical procedure, and a lot of people kind of forget that, in order to go in for a medical procedure, you need to be in a certain, condition health-wise to be even a candidate. So who's a good candidate for a mummy makeover?
So we want someone who's healthy, and there are a couple of criteria that are important.
Yeah.
We look at something called the body mass index, which is a relationship between height and weight, which is just a guideline.
Right.
And so we don't want people that are too overweight, and the main reason for that is complication risk. So we like people within a certain boundary. We often ask patients to lose weight beforehand, and that just makes the operation safer, and you get a better outcome.
Right.
And smokers and diabetics are patients that one really wants to avoid. I won't operate on smokers. There's too much risk involved.
When you say risk, what is it? Risk in the sense that, someone could die or?
Yeah, there's a whole range of complications, but smokers have an increased risk of skin dying.
Oh, wow.
That's called necrosis. They have an increased risk of deep vein thrombosis. And so they have increased risk of healing problems. So I think patients need to be well informed and have a good understanding as to the potential problems that can occur.
Let's talk about the potential problems. I know that a popular one that I've heard from various ladies has been those who've done a lift, either the nipple itself literally dying and going black or losing color and looking strange, as well as I know a friend of mine who did go and do a mummy makeover. She had liposuction first done, and she went into cardiac arrest and died on the table. So I do know the extreme sides, from a nipple dying to losing an actual friend in a procedure. Can you walk us through some of the complications of a mummy makeover? I mean, it is quite a hectic procedure.
Yeah. So I just want to separate between the breast surgery and the abdominoplasty, the tummy tuck.
Yes.
Because they have different risk profiles.
Yeah.
All surgery carries risk of bleeding afterwards,
right,
and infection and scar healing problems. So that's universal.
Right.
So we do take precautions for patients to avoid anything that thins the blood. Is antiseptic precautions that we take to reduce the risk of infection. So that can occur with anything. You have a gallbladder removed, it's got the same risks.
Yes.
Then there's the risks that are specific for that operation. And you mentioned that risk of a nipple dying. So that's why, I don't want patients who are smokers. They need to stop smoking beforehand and afterwards, because that increases that risk of nipple. Now, statistically, that risk is 1 in 1,000.
Okay.
So it is very uncommon.
Right.
And it's related generally to the fact that all our anatomy is different.
Yeah.
It varies from person to person, and it's about blood supply and blood drainage from areas that affect the wound healing. Tummy tucks are a different story.
Okay.
That's much bigger surgery, and it's often done with liposuction at the same time. And that's where we really focus on making sure that the patient is completely fit and up to it. Apart from those previous complications, you get other issues that are related to it. One is that you get some numbness above the scar. That's common with women who've had cesarean sections.
Yeah, I was about to say, I've had 2 Caesars, and I kind of feel if that's in the ballpark of a tummy tuck, maybe I could do this thing, But I believe it's a much longer scar than a Caesar scar.
It is a much longer scar, and it depends on how much extra skin. So obviously we like to reduce the length of that scar, but there's no point in making a short scar and then having rolls of skin out on the side.
Oh no, that's terrible.
So patients need to accept that. The main risk that we really want to avoid is something called deep vein thrombosis, and that's where you can get a clot in your calf muscle.
Oh.
That is very uncommon.
Yeah, you can also get that on a plane, right?
You can get that on a plane. You can actually get it. You can get it with, not having anything. It can just occur.
Sure, yeah.
And again, smoking increases your risk with that. And the danger of that is it breaking off and going to your lung, and you get a pulmonary embolus. So that can be serious. Now, these risks are extremely uncommon. And if you go for any surgery, you have that risk.
Yeah.
However, when you're doing cosmetic surgery, the bar for reducing risk, goes up to the absolute limit. So there's a huge range of things that we do to reduce that risk during the surgery and afterwards in the recovery.
Can you walk us through some of those things?
So we get patients to buy anti-DVT stockings that we put on them as they go to sleep.
Okay, I've seen those. They're like a bodysuit type thing.
Yeah, they're a bodysuit. They're quite tight. They're uncomfortable. Patients wear them for 2 weeks. In the summer, they don't like them. But it's all about compressing that area of the body so that the blood flows out easily. We also put these calf pumps on. They generate pressure, and they mimic you walking, and they get the blood out of the calf. And then we give them some blood thinning agents afterwards. We get them mobilized. We get them walking quite early. That's all the things that we do to reduce the risk of deep vein thrombosis.
I know when I had my Caesar, right, I walked the next day. And part of the walking immediately afterwards or a day afterwards is to help the blood flow.
Absolutely.
So after a mummy makeover, do you walk immediately afterwards, or do you walk like a Caesar a day after you get helped by the nurses, take your first steps?
Ideally, we like to get them just up by the bed within 6 to 12 hours afterwards. So just standing, just mobilizing. Mobilizing is part of healing. They're not as though they're wrapped in cotton wool until they're healed. So.
Right. So is it the same? I remember when I had my Caesar, the more I walked, the more it got better. And the more I felt better and the stronger I got. Is it the same? Or do you not have to walk a lot? Because I'm thinking it's a...
You got to be careful. It's a bit of Goldilocks approach. You want people to mobilize, but you don't want them to do too much. And you guide them through how much needs to be done.
How long is the recovery? So let's say I've done a mommy makeover. It's the boobs. It's there's the tummy tuck, and of course the liposuction.
Yeah.
What is the expectation of recovery?
Patients will probably be able to start driving a car somewhere around 3 weeks. 3 to 4 weeks afterwards.
Okay.
Your surgeon will guide you as to exactly what they feel. Some surgeons may be more conservative, say 6 weeks, maybe even longer.
Yeah.
And it's all about ensuring that the healing occurs well. And one of the components of the tummy tuck is to tighten the muscles. And there's a stitch that's put in there, and we want that to have healed well. And we don't want you doing anything that might pull that.
Because that could be disastrous.
That could be a problem. Extremely, extremely uncommon. I haven't seen it, but I mean, it is a risk.
Okay. One thing that I've picked up as well, I'll be scrolling through my Instagram and I'll see tummy tuck, mommy makeover, come to Turkey, get it done for like a third of the price. And I've heard of some girls considering literally packing their bags and spending a night or two in a Turkish hospital to cut, inverted commas, costs. I don't know, for me it just feels weird. What are your thoughts on these Turkey trips for procedures? And have you had patients that have come back and be like, yo, I was botched in Turkey. Please help me fix. And do you touch them or you go, go find another doctor. I'm fine. Thank you.
Yeah. So we're talking about medical tourism. It's often driven by a cost factor. And when your currency is strong, you can get things done. I'm not really in favor of it. I do some medical tourism, but I'm very, very cautious about doing an abdominoplasty or anything big, unless the patient can spend a lot of time near me. So if they're going to prepare to spend a month, 6 weeks, close to Durban, so I can look after them and make sure that any problems are sorted out, then one can consider it.
Yeah.
But the fly in, fly out, the risks are too great, because what do you do if there is a problem? What do you do if you get an infection?
On the plane.
On the plane.
18-hour flight. Right.
There are stories like that.
You start leaking, or I don't know.
Yeah. I mean, there's a story of someone who developed a complication, and the flight was not halfway to New York, and they turned the plane around to bring the patient back. Just to be clear, that didn't happen in this town, so it wasn't me.
Right.
But I mean, can happen.
Yeah.
So there's that Afrikaans saying, goed koop is duur koop.
Okay.
That's buying cheap is more expensive.
Yeah.
Excuse my Afrikaans for the Afrikaans listeners. But you want your surgeon to be available, to be able to answer questions, to guide you through that healing process, because you don't want to be stuck.
Right, you don't want to be stuck. As we get to the end of our conversation, would you turn someone away if you don't think they need the work they're asking for?
Yes. Part of my job is really getting an idea as to whether patients have realistic expectations, whether they understand it. And often I find that patients that are demanding, are under a time pressure, those are patients that I'm wary of. And certainly patients who
have body dysmorphia.
Yeah, body dysmorphia is quite a scary condition. I think more so for the patient, because they just don't feel happy about themselves.
Yeah.
And it's not easy to pick up if it's the first time they've seen you. However, it is something that I think we all saw, Michael Jackson.
Yeah.
Repeated surgeries, and each time you have that surgery, the outcome was worse.
Yeah.
So
there's a couple of famous people that you're like, ooh, what's going on here? All right, Doc. So my final question to you is this: mommy makeover, is it worth it?
Absolutely. I have many, many patients who just feel they've got a new lease on life, feel so much better about themselves. Their self-confidence is boosted. And the impact of cosmetic surgery in terms of personal relationships, feelings of well-being, it's not short-lived, it's long-lasting. And, patients, if they have realistic expectations and good understanding of the process, it certainly is something well worth considering.
All right. So I've got 5 things I've learned from this podcast. The first thing is, if you're a smoker or have diabetes, try and firstly stop smoking if you can, because you won't be a great candidate because you can reach complications. Secondly, this thing of flying out of South Africa for procedures could have some serious downside. I mean, imagine, like you said, being on a flight from New York and something goes wrong and they need to turn the plane around. It just sounds horrific. Also, I'm picking up that it's important to do your research about being the perfect candidate. So, like for myself, I know I'd have to lose a lot of weight and be in a space where I'm happy with the number on the scale, and it's just a matter of tightening up. The fourth thing I would say that's important is being realistic with results, right? Because I think sometimes you do these procedures and you expect, overnight results, and, as you heal, the results get better. And then I think the last thing is making sure I do all my research and finding the perfect doctor to do the procedure for me, because I can see it's a very intimate and complicated procedure, and having someone who understands that, I think, is important. Would you give me 5 out of 5?
5 out of 5. Well done, Carol.
Thank you so much. All right, so there you have it from the doctor. We've unpacked a mummy makeover, and it seems from both JoJo and from Dr. McGarr, it is worth it. Remember the 5 things that I spoke about, and at the end of the day, it's up to you to make up that decision. Dr. Paul McGarr, who is a plastic and a reconstructive surgeon from right here in Durban, South Africa. And now we know. If you enjoyed my podcast, please follow or subscribe to it via ecr.co.za under podcasts. And then you'll get alerts about new episodes. And please don't keep the Carol Ofori Podcast to yourself. Let's make the circle bigger. You can also email your big questions to my producer, Rory, at ecr.co.za.